Coughing, tiredness, body aches, and a runny nose are all common issues when dealing with respiratory problems, which can stem from the flu, COVID-19, the common cold, and even allergies.
Local health officials say with fall and flu season right around the corner, the number of respiratory-related illnesses is already increasing.
First of all, that there is a lot of respiratory disease going around right now. There's always viruses that are circulating, especially after the start of the new school year. So people still want to be sure that they're checking to make sure they don't have COVID.
However, in the southern hemisphere in Australia, there was an earlier flu season and the number of flu cases were higher than usual. Typically, the United States sees a similar trend in terms of the flu.
This year in the southern hemisphere, Australia kind of saw an early flu season and a pretty significant flu season as well. Usually, our flu seasons will look somewhat similar to what the southern hemisphere does over the course of the summer. So if that holds true this year, then what we might actually see is a heavier flu season than usual, and it may be an earlier flu season than usual as well.
With many viruses having similar symptoms, the only way to know what is causing individual respiratory issues is being tested.
So one of the struggles is that of all the different viruses, they all can, that cause infection in people, many of them can cause similar symptoms. Lots of viruses we don't worry too much about because they've been around for a long time and they don't cause severe disease. Some pathogens we worry a lot about. The COVID would be an example of that. And unfortunately, there's not a way to be able to tell the difference without testing.
Completely isolating during sicknesses might not be possible for everyone, but there are still ways to protect those around you.
You have respiratory symptoms, even if you think it's your allergies, test symptoms, and they have to be getting out and about, that they need to be sure and wear a mask, try to avoid contact with people who may be at higher risk of complications or issues from those viruses.
Dr. Bell says his yearly advice during this time is to get your vaccines, wash your hands, and stay home if you are sick. Vaccines are typically in place by the beginning of October, with health officials beginning to track local flu trends around that time as well.
Dr. Bell recommends getting the flu shot as soon as it becomes available.